The main impact of a health system is health.
Improving health.
The main impact is health. But can you give me something like outcome and something like output? Primary, intermediate, final. The final goal of any health system is health.
ذات الصحة عندهم ما تشتغل.
Yeah, it's right, but I mean something else. For example, access to healthcare, okay? Access to healthcare. Equity, quality, quantity, maybe safety, efficiency, effectiveness, cost effectiveness, and satisfaction, yes. Satisfaction. These are some, maybe it's better to say intermediate. Maybe access is more like this, and after access we have utilization. Utilization. Let me give you an example. Suppose somebody has got diabetes or blood pressure. How many people with diabetes have access to care, medical care for diabetes? Then which proportion use the health care, and which proportion of them the blood pressure or the diabetes is controlled? And after control is happy and is healthy and is okay. Okay, so if one outcome, you can divide it into 4. For example, I have access, then after access I utilize. After utilization, it's like, here we say coverage. After that, in medicine, we say effective coverage. Effective coverage means use and the blood pressure is controlled. Use medication and the diabetes is controlled. So when the disease, sometimes we use it and it's not controlled. And after control, sometimes somebody has blood pressure, you give him medication, you control the blood pressure like 10, 12, 14. What patient died, for example? Okay, or patient has got pain or discomfort or some psychological issue. So the blood pressure is controlled, but the final outcome is not, okay? So control of blood pressure or control of diabetes or control of, for example, some diseases does not necessarily mean the final health, yes? The final health mean, we said, mental well-being, physical well-being, social well-being, spiritual well-being. So he has got no, for example, blood pressure or no diabetes or no asthma, but still not healthy, okay? So it has got different levels of outcome or output. For example, let me give you example of malaria. In malaria control, sometimes you distribute bed nets to people to use it. So this is the first outcome or the first goal, that everybody has got access to bed net. The next part is they use it. Sometimes you give them the bed net, they don't use it. And after they use it, they don't get diseases, because if they use it but it's not effective, so we still have not the final outcome. Or for example, in vaccination. In vaccination, give me what primary objective? Access to vaccine. Yes? Everybody has got access to vaccine. And then they use it, and after use they don't get the disease, because sometimes the vaccine is not working well. So it's the final outcome is to become healthy, not to become ill. So we have different types of goals. So maybe the main element of any system is goal. Any system has got goal. Health system has got these goals. Okay? The main one is health. The main and the most important goal of any health system is health. But these are many other goals any health system has. So how the health system achieve its goals? How the system can achieve its goals? It needs some inputs. Please give me the example of inputs for health system.
It's like in Corona time, vaccinations.
Maybe.
Yes.
Then,
Making the vaccine available,
no, making the vaccine available is somehow goal,
access.
objective. Input means
Resource.
staff, okay? Staff means medical doctor, means nurse, means surgeon, means pharmacy, for example, dentist, and means these are human staff, means materials,
Resources, money.
materials like, for example, vaccine, medication, drugs, and means, let's say, facility, like hospital bed, and as you mentioned, means money, like how much, for example, dollars. So these are, and means, for example, IT, like health information systems. So these are inputs for health systems. For any system, we have input. And you can, input means resources. You mentioned that, resources. Any resource that we use to achieve the goal. So these are the type of inputs we have here. For example, in education system, what's the main input? Teacher, for example, and school. And for example, everything, tables, desks, and so forth. But here, so in a transport system, what's the main input? Driver, car, road. So road is part of the transport system, and signposts are part of the transport system. So here, the main, what's the most important resource?
The staff.
The staff, the human resource. Because without human resource, we cannot use other resources. Also money. Maybe after human resources, money. Because if you have human resources and you don't have money, you cannot. Money first.
Yeah, money first.
So you like money?
It's not that I like
I-
it, but it's important.
Yes. Yes, money is important. And facility is important. If you don't have hospital or, for example, primary healthcare facility and hospital bed, ICU bed, and these sort of consumables, like medication and vaccine and exam materials. So these are the sort of inputs that we use to achieve health. In addition to these inputs, we also need a sort of organizing them.